Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Surgery to remove hard scar tissue around a breast implant. A capsulectomy is a surgical procedure to remove the abnormally thick, hardened tissue, capsule, that forms around breast implants, a condition known as capsular contracture. During this surgery, the breast implant is usually also removed and replaced. The main types of capsulectomies are subtotal/partial capsulectomy, removal of some but not all of the capsule. Total/complete capsulectomy, removal of the entire capsule. On bloc capsulectomy, removal of the capsule and implant as a single unit. A capsulectomy is done to treat capsular contracture, as well as for other reasons like implant rupture, infection, or cancer. It is considered the gold standard treatment for capsular contracture. The surgery involves making incisions, removing the capsule tissue, and usually replacing the implant. Potential risks include implant failure, recurrence of contracture, changes in breast appearance, and poor wound healing. Recovery takes 4 to 6 weeks on average. Patients should follow their surgeon's instructions on post-operative care, activity restrictions, and follow-up appointments. Long-term monitoring of breast implants may also be recommended. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.